the session is not complete within today. In this 3 hours, the session is, I propose this session, but the course fees remain the same. You do not pay anything additionally for this. What I am going to suggest is, today I am teaching you the methodologies and the template. What I want to do is, I want you to practice, and you can go back in the app, whatever the specialty that you belong to, can be a pediatrics, OG, pathology. Dr. Dharni, which specialty you are into? So whatever
Sir, in general medicine, sir.
General medicine. So what you can do is, you can go to the lectures. You can just see how the faculties are handling their subject, how they are delivering it, what is the kind of presentation they're doing for the subject. You can just take an idea about it. And you also make one presentation like that. We make one presentation like that, and we will have a scheduled time on Sundays. And you can fix a 15 minutes one-to-one slot with me, and you can present to me, and I will tell you what all things to be added to your presentation. You can present one more session also in a subsequent Sunday for 15 minutes, and you can fine-tune your presentation and your methodology of the delivery of the content that you want to give for a subject. Thereby, you will get, to some extent, at least to 50%, you will become fine-tuned. And after that, you can engage with speed also. You can take classes, we can give you opportunities in speed, in a graded methodology. We have a system in place how to train a faculty, and you can come to it, and there you will start earning also. And you will earn by making one MCQ, you will earn a value, you will earn an honorarium, and you have a test and discussion, you earn an honorarium, then you will give you short classes, you will earn. So there is a mechanism where you will be able to monetize, that be able to be a faculty. At the same time, you'll also make some value for your time and your contribution. So that is also there. If you are interested, you can do that as well. So what I am proposing and suggesting to you is, you make 2 more sessions one-to-one with me, yes, on subsequent Sundays, and make a presentation what I am making right now today with you, and so that I can sit for your class as a student and you be a teacher to me, then I can give you feedback on that. That's what I'm trying to propose to you. Okay. And this app, whatever we are doing it, the same will be recorded and put it across into the app, so that you can revise, or you want to just go back to and see what all we have discussed today. You can just have a glance on that. Is it clear? So any feedback that you wanted, any questions that you want to ask, you can do so now. So that before I start the next session, this next session is all on techniques. Yes.
So I had a question about the previous session.
Yeah.
It's more of a practical question related to practical stuff. You were telling the story of Dr. Santosh and the refund fiasco.
Yeah.
So we always get this kind of stuff from parents for various reasons.
Yeah.
I think this was a case where you could actually manage and get the student out of the woods and get him into a very glorious career. But most of the times the refund requests are very unreasonable, and it's not, you cannot really convince the student nor the parents. For example, they don't just show up, they sign up and then they just don't show up, and they come for a refund after, say, 3 years or something. When it is too late, or somebody then switches from, say, USMLE to some other this thing, and they would have completed, say, 60%, 70% of the stuff, and they want refund. So is there a refund policy as such that you get students to sign before they start?
Yes.
Okay.
So what is that?
How do you deal with these difficult parents?
I'll tell you.
They are very aggressive at times.
I will answer this question in 2 ways. Now, we have been running the Speed Medical Institute for past 20 years. So far, we don't have any litigation from any student till now. For almost, we handle more than 3.5 lakh students, I said as early. Two things we follow actually. One, what we follow is, irrespective of the course fee, whatever might be the number, amount, there is a policy that is added in every application form, that no refund or transfer of this fee done at any point of time after registration. That is a clause that has to be signed by every student to do it, because it should not be like a come and go. That means you come and you want to buy some decision, you come and because you're not be serious. And if you do that, it will spoil the other students. And see, refunding is not a question. See, refund of one student, you have the student and one student, you refund, it's okay. But what will happen is the student will not keep quiet. The student will go and influence certain other students for different perspective, and they will also start asking this question. That's how as a teacher or a faculty or an institute will face this issue. Now, though you get in writing that the fees is not refundable or transferable, even in spite of the class, people will pressurize you for some things. I didn't like this class. I didn't like the way you taught. I thought this will be like that, but I didn't expect this is there. See, this disproportionate things
they'll have multiple excuses. Yeah,
multiple excuses. So for those reasoning, it's very difficult to address. One thing which I am very, very clear about it is one health related issue. Number one, if the student is not fine, and if the father or parent is not fine where they have given the fees, or if he has got a seat, he has joined, but after the counseling he has got a seat. Though we get it in writing that we don't refund or transfer, for them, we do it morally because there's a genuine reason. The reason is he is not healthy, the parent or him is not healthy, then we should consider that has to be refunded. Number two, if they are getting married or pregnant, is a female candidate and they are getting married or they are getting children, you can tell them, we will transfer this course for 2 to 3 years. We'll give you, allow this course to do it for 2 to 3 years. We can give those options. In case they are also not feeling, sir, at that point of time, I don't know what I'm going to do, refund it. And marriage for, especially not for men, marriage for women. Yes, we're talking about marriage for women, and that has to be considered because I strongly believe in that area, we need to definitely support them. And during pregnancy, we need to support them. And other than that, rest of the issues are purposefully made. And to get a refund after half of the course is very difficult to decide. Half of the course you have done, or 1/4 or 1/3 of the course was done, then it's refund. And you have to stand by the clause that you have made, or the sign that you have got, because we have invested considerable time and considerable energy, and we have prepared the course, and it's based on not one person, it's based on the whole batch, and will be in a share given to on basis of student, and we may not be able to do so. That you should not handle by yourself. You will always ask the person as a relationship manager or somebody to deal with that and get to go along with that. And in case they are trying to, the course fees is 10,000, but they are sending the notice, legal notice. It is worth of 15,000. That means he is not interested only in the money. He want to disturb you. So in that situation, you contact you have a lawyer and ask them to give a reply and settle them through the lawyers itself. If somebody is giving you a disturbance that he has to spend more than what is the refund, that means he is not interested in that refund. He is interested in something else. The student which are really genuine on that aspect, definitely will not trouble a faculty, because this is a small ecosystem we live in. And definitely they want to always have a good relationship. So I think these are the way that we generally handle. And one more thing that we do, they are really very keen. We'll ask them to transfer the course to someone else, and we'll give those transfer to the candidate who is telling in that way, so that we can solve these issues. And at most, I always see to that a good relationship is maintained at any cost. Or he can refer someone and he can give that course to someone else, to them whom they wanted to. So those options are given. I think it gets solved. Okay.
Yeah. Thanks. Yeah.
So now what I'm going to tell you is how the questions are made. So the manufacturing industry, that means when you say in a manufacturing industry, how to make the product. Here, the MCQ is a product. How this product is made by the examiner. And how, see, I'll tell you the point number one you need to understand. As per the instructions and guidelines of an MC, the questions have to be made only from standard textbooks. I'm telling you again, only from, it does not come from the sky. It does not come from anywhere else. It does not come from the journal. It comes only from the standard prescribed textbook of your specialty. If suppose Aravind says it is from Nelson, I'm telling you. Yes. And pathology, it is Robbins. And OG, it is Williams and Novak. And if it is from medicine, Harrison, 21st edition of Harrison, not even 20th edition of Harrison. Dr. Dharnidharan, you understand what I say?
Yes, sir. Yes, sir.
It is 21st edition of Harrison. Does not mean that probably, you have finished your medicine, right?
Yes, sir. I completed my medicine.
So now you would have read 20th edition, am I right?
Correct, sir.
Now, what will be your comfort level? Your comfort level is to teach from 20th edition, am I right?
Yes, sir. But I already recently bought my 21st edition. Actually, if you'd allow me, I'd like to share you my story as well, sir.
Yeah, please.
I joined DNB Medicine. I actually had passion for teaching ever since I was in MBBS.
Okay.
But for some reason, I couldn't get into MD seat.
Okay.
I got some 5,000 and odd rank. I don't want to get into a private medical college. I got into DNB, sir.
Okay.
After that, since I was doing DNB, I couldn't get much academical exposure as well.
Okay.
But I was doing a lot of presentations for my consultants when I was there under them.
Yes.
So I completed my DNB General Medicine 1 year ago. I joined as an SR at a medical college.
Where?
And Apollo Medical College, Chittoor.
Oh, very good. Okay.
And I took the super specialty SS course from Speed as well, sir.
Okay.
Not because I strongly wanted to pursue the super specialty, but in order to learn from them. Because when I was in post-graduation preparation as well, when I'm looking at different teachers, I used to get thoughts that this should be taught in such a way, in this way. Why was this taught in a difficult way? Instead of learning what they're teaching, I was thinking in this manner.
Okay.
So I thought that I should be a teacher sometime in the future.
Okay.
That's why one of the reasons is that is why I took the Speed SS course as well.
Okay.
And I saw this lecture as an opportunity for me to grow in my future as well, sir.
Good. So it's a good idea. You learn. There are a lot of people doing it actually. That many of the professors and assistant professors, associate professors prescribe this Speed app for them to learn and teach actually. And also, those students who have passed their SS and they got into any specialty, they still keep using the app for their final exit exam of DM or MCH, because the reading the book or that does not have time for them. They're into clinical practice and they're doing it. So it's good that you have a very keen passion in teaching and to do so. If you could ask me, this is one of the greatest avenue today, the avenue for a postgraduate, when we have different people at different stages of their medical career. And if suppose I take Dr. Aravind, in a second year of PG, he may not be able to earn more than 50,000 rupees as a stipend. Am I right? So what I am trying to tell Aravind is the passion in his own aspect, always this focus has to be only in teaching. I'm telling you this again. This is a very important point that you need to learn. A teacher should take class and the money should follow it. I'm telling you again. The teacher should take a class and he is satisfied by taking a class and delivering a lecture, and he is happy in doing it. Number one. The byproduct of this teaching is the finance, which comes as a process. But after some point of time, once you become a seasoned teacher, it will go reverse. What will happen? Because I am getting this money, I am studying and teaching. Once this comes, the fall comes. You understand what I say? You understand? See, in the initial stages of career, you are interested in teaching, you are into the process. Once you teach, 2 to 5 years, you grow in the learning curve, and once at some point of time, you become a recognized good teacher for sustained efforts. At that point of time, with the what intention you started in day one, the same intention has to be there in that time also for you to still grow further. Yes?
Yes,
and
yes.
always the money has to be only a byproduct for a teacher. It should not be a main product. The main product is only teaching. And only this you follow, you will keep sustaining to grow more, because I have seen more number of faculties who started their career with very innocent and nascent. They all turned to business people. So I'm just telling you again, they started their career like a baby who born on this earth, and they started their career in teaching. And once they started growing, at some point of time, they become a businessman. See, I will tell you, teaching, money comes is also business. I'm not saying no to it. But that is for the outside world. Yes. For professions like people like us as doctors, to our mind, we'll be only professional, not businessman. Anywhere money comes and goes out, it's a business. There's no doubt about it. But what I'm telling you is in your mind, whatever people call around you, let them call. But in your mind, you are doing things which are passionate to you and make sense to you and to the student who are teaching them. So once this is on, the same attitude has to be there till the end, as long as you want to do this. I have seen people who have turned to a businessman has lost their career in this field. So that is not long run. They have vanished out of this. So, or they would have made a sustained effort if they have kept still the passion of teaching with them. So that's what I'm trying to tell you. So that has to be there. So what I'm trying to tell you here is, this could be a great avenue for you to earn as well. And that earning has to always be a byproduct, that keep it in your mind. That's the reason why I just touched upon that. And that can help you in your things that you wanted to do. And you want to invest on further teaching skills, you want to invest on the course that you want to learn, and you want to take care of your studies, and you want to take care of your family, take care of your children. So it can be utilized for those purposes which are very essential, so that you can focus on your profession. Okay. So if you ask me how many teachers you would have trained roughly in your career for so far, I do both together. I would have done almost close to 500 to 600 people I would have made as faculty. And right now, there are almost 350 faculties along with me taking classes. I'm giving classes to them for various courses. And also, I have kept them happy. I have made them really happy for both what they wanted to do and also financially as well, for the amount of time and the commitment they have spent towards it. And so that their standard of living and the way of living has also gone beyond comparison with their peers. So you're able to understand what I say? So it has to be balanced. Initially, it may not be, but after some point of time, the sustained effort, there should be equal valuation has to be there for the efforts put in. Only then it can be sustained. Any project can be sustained. Okay. So now what I'm going to do is, I hope I have discussed with all of you. Now what I'm going to do is, I'm going to just teach you the way how the questions are made. Now just read this question. You'll be able to understand. Clinical based, this means this is the type of question where the next is planned about. There's a clinical case scenario based question. What is about next is all about. And all of you, I think, will be keen interest on the next as to become a faculty member. And Ram, a 35-year-old patient, came to the OPD with the chief complaints of colicky abdominal pain in the right upper quadrant that radiates to the angle of the scapula and aggravated with intake of food. What could be the possible diagnosis? See, when dealing with the clinical scenario type of a question and a factual question, clinical scenario type of questions are the easiest question to answer. But the student will not take that way. Whenever he sees a big question, for him it's a difficult question. Whenever he sees a single line question, that is an easy question. Actually, single line questions are difficult, the most difficult question actually. As a faculty, you should know this. Because single line question does not give you any clue, does not give you any help. And it's very difficult, extremely difficult to derive an answer. But in a clinical scenario, even you don't know the appropriate subject to the content which is given, but still you'll be able to derive an answer out of this. I'm telling you, even you don't know anything, so you belong to a different background, but still I'll be able to make you answer this question, yes, with some common sense. I'll tell you why. So what are the options given here? Acute appendicitis, pancreatitis, duodenal ulcer, and biliary colic. Correct? So these are the options. Now, today, in today's making of MCQ, you read the question and read individual options alone is not correct. You should read all the 4 options. Today, the way they make the question is, only you read the question, all the 4 options, the question becomes complete. Previously, in those days, how it was, there was a question which was standalone, all the 4 options which are standalone, and you need to just match for this question what option I should make. That's how it was. Today, it has changed in a way where you read the entire question along with the 4 options only, you will be able to understand the question itself. You just need to understand this first. And Only then the question becomes complete. Then you will be able to comprehend what they are asking. Okay. So now I'll tell you the keywords, how you need to mark the keywords. See this. So whenever you make a question for a student, age is very, very important. And this name is also very important. You tell me why name is important? Why you would have given just a patient, no? 35-year-old patient just you would have given. Why the name is important?
Tells you about the gender.
Correct. Now Ram, that means he's a male. Right? So there are pathologies and presentations which are peculiar for male and female and present more predominantly in male or female. Not only that, it will to some extent, yes, to some extent they will give name along with their occupation also. So with the occupation oriented areas, you will be able to come to a conclusion. Okay, he is working in a leather factory. Suppose they say working in a leather factory and he is coming with a ureteric colic or he is coming with a hematuria. Then definitely you will be able to fix, okay, leather industry, tanning industry, urinary bladder carcinoma is more common in those areas. So with this itself, you will come to some conclusion, okay. And those other options and other points in the question along with the options, you will be able to fix a particular answer. Okay. Now, name will able to mark the gender and the age is also very, very important. What disease is more common in younger age group, middle age and the elderly age group. And came to the OPD with the chief complaints of colicky abdominal pain. So this is about the pain. And where is the location of the pain? Right upper quadrant and radiates to the angle of scapula. So whenever you look into the presentation, so this is the umbilicus. So whenever you do a question, you should make markings like this. You should start drawing like this because this will help them to understand what is going in your mind. Okay. And you need not be a great artist, but you should be able to deliver what you think. Now, what he says, colicky abdominal pain is the right upper quadrant. So this is the right upper quadrant. So this is the umbilical plane. Correct? Understood? Now, this is the area where he says pain, right upper quadrant. This is the area. Now, this radiates back to the scapula. Correct? Now, if it is a pancreatitis, the pancreas is located here along with the C loop of duodenum. So that will be in the epigastrium, correct? So that pain will be in the epigastrium. And duodenal ulcer will also be predominantly in the epigastrium. And acute appendicitis will be there in the right iliac fossa, correct? So the location of pain itself, you are able to locate in the right upper quadrant. This is the location of the gallbladder. Yes, and common bile duct and CBD, right? And aggravates with the intake of food. So something related to the food. So related to the food will be here mostly of can be related to pancreatitis or duodenal ulcer or biliary colic. Definitely not acute appendicitis. It is over. By location and relation to the food, appendix will not be there. In that only, rest three are there. Pancreatitis and duodenal ulcer. The location of pain will be in the epigastrium. And biliary colic typically said from the right hypochondrium and going back to the radius to the scapula. Okay. So, and it is colicky in nature. Understand? Colicky in nature. And pancreatitis is not colicky in nature and duodenal ulcer is also not colicky in nature. So, pancreatitis is a diffuse abdominal pain predominantly in the epigastrium and duodenal ulcer is also continuous. Both pancreatic and duodenal ulcer pain are continuous. They are not colicky. So, colicky pain are generally seen in a structure which has a narrow hollow viscus. Okay, like in the CBD, like in the ureter, and like in the intestine. Okay, especially small intestine. Yes, this is in the CBD. Okay, and this is in the kidney, the ureter, and ureter stone coming into from the kidney via the ureter into the urinary bladder. Yes, and when it is obstructed, it can cause colicky pain. And when there is a CBD calculus, yes, coming down along the CBD to the duodenum can have colicky pain, correct? And intestine, small intestine especially, any tumor or any obstruction, yes, can cause colicky abdominal pain. So colicky means refers to all these three structures which has a narrow hollow orifice and there is an obstruction causing them the colicky pain. Is it okay? Are you able to understand what I'm trying to say? You can type in the chat box also so that you know your response. So by this, so you need to create a question which is meaningful, which is wholesome, which is complete, which is informative. And when you're teaching, it should be a learning MCQ. Understood? So by this, we know that acute appendicitis will have rebound tenderness in the right iliac fossa. Pain will be localized to the right iliac fossa. Pancreatitis and duodenal ulcer can have pain around the epigastrium, and pancreatitis pain can move straight to the back and back also, not in the scapula. And right upper quadrant typically, and to the back of the scapula related to the foot, will be biliary colic. In other words, duodenal ulcer, food will relieve the pain. Yes, food will relieve the pain. And pancreatitis pain will be also can be related, but it will be a continuous pain, will be more pain. So it will not be a colicky pain. So this all things that you should make it sensible and meaningful for the students as you frame the question, and gives a challenge for the students to answer that. So the training has to be the same way. So you need to behave like an examiner. Understand that first. So whenever you're a teacher, you give them the comfort level that I am your teacher, I'm going to help you, and I'm going to support you, and I'm giving you the knowledge base that is required to solve these MCQs. And at the same time, I'll give you the techniques, but you should imagine me. You should tell the student, your students, that you should imagine me as your examiner. So you should play the devil's advocate that you will be an examiner. So a student will understand that this is what the examiner will think. This is how you will also take on a question. And this is how he will also expect answers from me. That's the impression that you need to create for your students, because the language of the exam is MCQs. So you need to speak in the language of MCQs. You need to teach a concept, and finally you should say a summary. Like whenever you send a patient for an ultrasound or CT or MRI, they give you all the detailed description. At the end of the day, impression only 2 lines. Yes, the patient right iliac fossa probe tenderness is positive and suggestive of a acute appendicitis. Kindly correlate clinically or suggestive of further CT. Something like that they say, no? So you should also summarize your teaching if you're giving a concept-based teaching. Now, how is this question derived? How this question is made? See, this question is taken from Bailey and Lau, Practice of Surgery 20th edition, page number 1052. Okay, so this is what we have typed actually. This does not appear the same way. It is essential to establish. See, that is essential to establish. See this? And you should have a detailed explanation reference. These are very, very important. Whenever you say something today, students don't believe us on the face value. They want reference. Which editions? Latest edition, 20th edition. Page number what? 1052. Like this you should talk. And whenever you have listened to some lectures and people say, in Bible, page number this quote is there. In Bhagavad Gita, page number this quote is there. Something like that they say. Without reference, people will not believe you. You might be the, the legend of that specialty. But today, no student will believe in a teacher without page number and recent edition of a standard textbook. And even more important, that is, you need to have the cover page like this. Understand? So this will give more authentication. So whatever you say, you should play and teach within this framework only. You understand what I'm saying? You will have to teach only in this framework. You might have n number of experience, but today's era, in this era, today, you will make a convincing statement, authentic statement, and say 100% because it is given in a standard textbook. This cover page has to be scanned. This picture has to be there. And you have to say which book it is, and you say edition and page number. This is very, very important. So this will add, nobody can question you now. Whatever you have said, this is given in a book, as per book I have taught you. This is what the examiner will also take. So it is essential to establish the site and the nature and the radiation of the pain, the rapidly onset and associated with the relieving features such as food intake or vomiting. Thus, the biliary colic is classically result from colicky pain in the right upper quadrant of the abdomen that radiates to the angle of the scapula and associated with the food intake, which results in cholecystokinin release and the gallbladder contraction. Now you this. This is the raw data. See this book. This is how it appears in the book. See this. How this question I took. This question I have taken from the said page number. It is page number 1052 from 20th edition of Bailey and Lau. And this is how it has appeared. Now, examiner will also understand this. Examiner will also read from the book, the same book, because this is what is prescribed. And from that book, when he reads, if he wants to make an MCQ, this is how you'll make an MCQ. So this is a simulation that you need to make for your student. Now see, the same it is here. It is essential to establish the site and nature and radiation of the pain, the rapidity of the onset associated with the relieving factors such as food intake or vomiting. Thus, the biliary colic will classically result in colicky pain in the right upper quadrant of the abdomen that radiates to the angle of the scapula. It is associated with the food intake, which essentially results from the cholecystokinin release and gallbladder contraction. Yes, see that. The pain of acute appendicitis starts from the umbilicus and thus shifts to the right iliac fossa. That is a localizing pain. In acute pancreatitis, often has an abrupt onset of the severe epigastric pain radiating to the back that we discussed. Yes, which may be similar to the pain of connecting the peptic ulcer perforation or leaking aortic aneurysm. Intestinal colic is most frequently associated with the periumbilical pain and abdominal distension. More distal the intestine in the pathology, the greater the degree of distension. Vomiting is an early feature of proximal small bowel obstruction, whereas the absolute constipation is an early feature of colonic obstruction. Renal or ureteric colic is intense, located in the flanks, radiating towards the lower midline of the scrotum, is usually associated with the macroscopic or microscopic hematuria. So this paragraph talks about pain. If suppose various different type of acute abdominal pains. Now, if an examiner wants to ask the question from this paragraph, you tell me how many questions he can ask? From this paragraph, how many questions or possible questions could be asked from this paragraph? You can just type in the chat box. I will just discuss with you. Yes, what he says, as we discussed in the book, it says acute appendicitis, right iliac fossa, pancreatitis, epigastrium, back, duodenal ulcer, epigastrium. And one more thing he added is a ureteric colic. Ureteric colic from the loin to groin, correct? Now, based on this, what is given in the book, in the paragraph description, now we let us start this question. Though you are from different specialty, still you will be able to answer. A patient complains of pain in the periumbilical region initially, now in the right iliac fossa. What could be the possible B? What could be the answer? A, B, C, D. Initially periumbilical. Yes, there is a referred pain, T10 dermatome. Now localizes to the right iliac fossa. Yes. What should be the answer? Because all of you are not 100% to it. Because of the reason it is not related to your subject. Clear? You want to just look into the model, not go into it. That's what the student will also be. The same mentality will be there. Yes? Because now you come to a specialty there, all 19 specialty for a student is important. So, periumbilical region and to the right iliac fossa, the answer should be, you can choose A, B, C, D, anything you can choose. Right iliac fossa, which pain will be there? What is there in the right iliac fossa? It's a basic question. Na? Across the specialty, right iliac fossa, what organ is there? Inflammation of what organ can cause right iliac fossa pain? Correct. It should be appendicitis, acute appendicitis. Where it was given? In the description of the book. See that? Pain of the acute appendicitis starts around the umbilicus and then shifts to the localized to the right iliac fossa. So this was the first question. So during the preparation, this was the first question. And pain of acute appendicitis around the umbilicus then shifts to the right iliac fossa was the second question now. See, in acute pancreatitis, often the abrupt onset of the severe epigastric pain radiating to the back may be similar to the pain emanating from the peptic ulcer perforation or leaking aortic aneurysm. Okay, now let us look into the third question. Here's the other question. Which of the following is true? See, kind of questions are different. So I want to show you different types of questions. That's the reason why I posted this. Which of the following is true? That means only you read all the four options, only you will know the completeness of this question. Vomiting is an early feature of proximal small bowel obstruction. Constipation is an early feature of colonic obstruction. Pain is similar pain of leaking aortic aneurysm. So for you to answer this question, I'll go back to the test again. So you just take the factual memory and apply it here. See this? Acute pancreatitis often has an abrupt onset of severe epigastric pain radiating to the back, which may be similar to the pain emanating from the peptic ulcer perforation or leaking aortic aneurysm. Intestinal colicky is most frequently associated with the peri-umbilical pain and abdominal distension. More distal in the intestine, the pathology, greater the degree of distension. Vomiting is an early feature of proximal small bowel obstruction, whereas yes, abdominal constipation is an early feature of colonic obstruction. Correct? So up to this, we have got the third question. See that? Let's go back. See this question. Third question. Vomiting is an early feature of small bowel obstruction. Constipation is an early feature of colonic obstruction. Pain in pancreatitis is similar to the pain leaking of abdominal aortic aneurysm. What is the answer? All of the above. Okay. Now, let's move on to the text again. Renal or ureteric colic is intense and located to the flanks and radiating towards the lower midline of the scrotum. It is usually associated with either macroscopic or microscopic hematuria. Okay. See this. A patient complains of intense pain in the flanks radiating to the scrotum. History of hematuria is present. What could be your diagnosis? So, should be very clearly. What should be the answer? So, bleeding, hematuria, bleeding, blood in the urine. So, that should be related to KUB system. So, that means what is the answer here? What kind of diagnosis that you should make? Just attempt. Nothing wrong, even make a mistake. Yeah, sure. Yes. All of you, correct. 100 marks to all of you. Yes. Now, even you are interested or not interested, but I have made you to learn this. Yes. Ureteric colic. So how many questions we have taken up? We have taken up from this paragraph of the textbook of what I read in specialty that I teach only, I'll be able to tell you. So we have taken the fourth question also from this paragraph, line to line. So what is inference? Inference is this. So how to convert a text in a textbook of your specialty into MCQs and different types of MCQs. Yes. And will you agree? The four questions which I have discussed, covers the entire paragraph. Hello, say yes or no. The four questions which we have made and discussed now covers the entire paragraph. Yes, correct, perfect. So, the language of exam is MCQs. So, as a teacher, my duty is to convert the entire text into MCQs. Say yes or no. As a teacher, for the upcoming exam, my duty is to convert this text into a MCQ like this. Yes or no. Only you put YN. Yes. Then says no. So the language of the exam is MCQs. So it will be good for me to teach my student through MCQs to make him to learn what is given as a text in the book. Yes. Now that means I need to convert the entire standard textbook of my specialty into questions like this. Yes. Now, I will tell you the challenges. Before that, can I tell my student, you attend this MCQ discussions on my class, 100% it will cover the subject that you wanted to read by yourself for the exam with 100% accuracy. Is it possible? Yes. If I teach the entire book through MCQs like this, cover line by line, and if they make them to understand and answer this, revising these questions alone, reading this question alone, will it capacitate the student to answer in entrance exam? See, the entire book is like this. If I have to revise the entire text, the way it is given in the book, will I be able to do it? Will I be able to do it before the exam? It is totally 1,500, 3,000 pages. And the effective revision advised for the student to make is 5 revisions. I'm telling you again, effective revision to be made is 5 times. Can I revise the text like this in the book for 5 times? Will I be able to do it before exam? Not possible. The only way to revise is through MCQs, because reading an MCQ, marking an answer, the time taken is very less. And today, the advent of technology in the app, they can quickly click of a button, they can finish. Yes. So what I'm trying to tell you is the language of exam is multiple choice question. The language of the exam being a multiple choice question, teaching has to be predominantly towards a competitive entrance exam of multiple choice question type. And once they have learned through this process, yes, you will make them revise in the same process. And when the question comes, they will have ready-made answers to answer. And you can ask me a question, sir, if the student does not know any subject and any concept about pain or any of this topic, then how will I be able to take them directly to the question? Yes, it's a valid question. You should have asked me, but probably that will be in your mind to ask me. In that situation, what I will try to tell you is, even before starting an MCQ like this, you give them the brief. How will you give them the brief? Tell them, when we discuss about acute pain abdomen, okay, just start a lecture, 10 minutes of a lecture before you start discussing the MCQs. Okay, and you will just make a picture like this, how be made. Okay, so in your own handwriting. So acute abdominal pain are caused by, yes, tell them, you write it in points. Number 1, acute appendicitis, perforation of duodenal ulcer, acute pancreatitis, and acute ureteric colic. And number 5 is biliary colic. You tell them this. So this classification has to be this. They'll also take, they want to take notes, they can also take notes. And you will tell them. And you have the appendix in the right iliac fossa. Okay. Appendix in the right iliac fossa to ileocecal junction. And appendicular pain will be localized to the right iliac fossa. Initially will be periumbilical pain, because periumbilical pain, the dermatome is T10. And ileocecal region dermatome is T10. It's a referred pain. So T10, periumbilical pain, then shifts to the right iliac fossa. It's called localizing pain. So right iliac fossa, periumbilical to right iliac fossa, the pain will be typical of acute appendicitis. Rebound tenderness will also be there in the acute appendicitis. You brief them that way. The next, when you talk about the pancreas, when you tell them the pancreatic pain, yes, the pancreatic pain will be there predominantly in the epigastrium and radiating to the back. Yes. And will be a continuous severe epigastric pain radiating to the back is about the pancreatic pain. And then we talk about the duodenal ulcer, it will be in the epigastrium and it perforates, it causes gourding, rigidity, on all those acute abdominal signs of intestinal perforation. And acute, and talking about biliary colic, we already discussed the gallbladder and the CBD system, and the stone in the CBD and in the gallbladder contraction causes pain in the right upper quadrant and radiates to the back is typically of a biliary colic. And ureteric colic, you tell them the kidney, stone in the kidney. Yes, the most common type of stone is calcium oxalate, and that a stone has to be excreted by the way of from the ureter to the bladder and the urethra and out. As it travels from the kidney to the ureter has a narrow orifice, and as it travels down, any partial obstruction or a complete obstruction of the ureter can cause ureteric colic. The pain radiates from the loin to groin. So when you describe like this, he gets an idea that a pathology in which organ and what location can cause what kind of pain. So you'll be able to give you a brief before you start the class like this. And once you started like this, then after that, you post a question like this and you'll be able to answer it. Are you able to understand what I say? So, you know, but you have to play the game only in this area. Yes. So similarly, for any topic before you start, you give them the brief for 5 to 10 minutes. How the pain and any topic, and you tell them this is all about, then go into the question. Now I went to the question directly, you found it difficult. But if you have done it in your specialty of your choice, then you would have felt very comfortable. That's the reason why this time has taken. All you have been felt comfortable, right? So now this methodology can be adopted. Now for whom, what should be done? For the students who have read well, you know how you have a batch, they know very well the subject. Then directly you can go to the question and start discussing. And for a batch of students, you feel that you have to tell them the basics itself. You should start basics. That means where is appendix? Where is pancreas? Where is gallbladder? Where is kidney? Where is ureter? Everything you need to tell from the basics. Then tell from the basics and tell them, what all the symptomatology each and every organ and pathology can have. Then brief them, make them understand that, then go to the question. Hello? So the two methodology are antegrade learning, retrograde learning. So if you are taking your notes, what I'm trying to tell you is there are two important methodology in learning is antegrade and the other is retrograde. Retrograde is post the MCQs first and discuss the MCQs and fine-tune the answer, then go for the explanation. Okay, antegrade is first theory. Teach them the essential theory that is required, that means the knowledge that you give to them, then go to the MCQ and discuss the explanation. So students who are well read, go for retrograde, antegrade from the basics, students who are not well read. And if you consider, because I'll tell you why, you can ask me a question, sir, for everybody antegrade is better, na sir, we will not know which student knows more, which student does not know. Yes, of course, yes, that is a good technique. But if you have a batch that they are well read and they know the subject well, the basics, to them antegrade learning will not work. They will always prefer retrograde learning. So you should know to whom to teach and how to teach and what to teach. That's very, very important for the class to be successful. What is the success of a class? Today, you know what do you mean by the success of the class? The success of the class is the people stay till end of the class. Is the success of the class. Today, in today's language, if people join in your first hour and half of the population leaves in the second hour, and at the last, only the faculty stays online, this is a class by failure. This is the sign. And yet another important point I'll tell you, do not look into the time and teach. Do not look into the completion of the subject. This is the gross mistake a teacher can do. And that will happen on the initial days of teaching. What I'm telling you again, do not look for completion. Because I have to complete, you will rush. Your idea, within 2 hours, I need to tell this. Whether student understands or not, immaterial. I have to complete this. Because time allocated to me is only 2 hours. See, they will allocate 10 minutes, 15 minutes for your lecture in college. Within that, you should finish. Then they'll bring a bill. This does not work in competitive entrance exam. Competitive entrance exam, within the given time, how much of knowledge you can deliver for a student to understand crystal clear. Only those students will be benefited and students will also like it. So you should not be compelled by time. So no time compulsion has to be there. So takeaway and delivery to the students is the priority to be given. Can I go to the next presentation? They will give you like this. They'll give you an image in an exam. So you need to understand. Identify the sign on a breast MRI. Here, there is no support from the question. The entire decision in answering this question is only based on the image. Right? So the right answer is Linguni sign. So it's a rupture. It's a rupture of the breast implant. It is seen here. This is called Linguni sign. Yes. And for this, two things are very important. First, a student should be able to read the image and he should know what to see in the image. And on seeing the image, that to relate to given options. Only if he knows Linguni sign and if he knows it's an implant and it's a rupture of the implant only, he will be able to answer this question. Yes. So this kind of questions now have started appearing in NEET and NESS exams. So you have to make questions in these areas, images, instruments, histopathological slides, and gross specimens. So all these are part of the game today. Identify the classical sign here. See that once he is upright, is like this. Once he elevates the arm, you see the flushing in his face. Okay. So a maneuver could cause flushing in his face, and looking into the neck of this patient has an enlargement of the thyroid. So, and it is continuous with the lower border not able to made out, upper border of thyroid is seen, but lower border is not seen. That means it's a retrosternal goiter, correct? When retrosternal goiter, as he puts both the upper limbs up, he creates a narrow thoracic inlet. So then it goes on compressions on the superior vena cava. The minute it compresses the superior vena cava, it becomes flushing on his face because the drainage of the superior vena cava is from head and neck veins. So then that is called Plumberton sign. So this much of knowledge you need to have. Okay. So clinical science today in next is become important. When you have to teach the student, you have to teach them clinically. Now, previous of my presentations were theoretical. From what is given in the book, I extrapolated to the MCQs and I want to teach the student. Now, what I am teaching you right now and telling you right now and showcasing right now to you is on clinical examinations. Now, you understand in the prescribed examination pattern, more than 65% of questions are going to be clinical scenario based questions. So if it's going to be clinical scenario based questions and applied basic sciences, now all this will come into play. Now see this, identify the commonly done investigation on parathyroid gland. They'll give you a radionucleotide scan like this. So that means it's going to be the language of clinical science. And when they give you like this, and the student should identify what type of scan is this. Okay. So this parathyroid scan is called, yes, System EB scan, Technetium 99, molybdenum, System EB scan. Name of the scan is System EB, and it shows an ectopic parathyroid gland. Ectopic parathyroid gland. These are thyroid and parathyroid glands. So thyroid and parathyroid glands can take up Technetium 99. This is called System EB scan. Just to tell you the type of question they can ask. You see this? What layer does the yellow line indicate in the esophagus of endoscopic ultrasound? See the level of the question. So they can give you an endo-ultrasonographical image like this. Yes, and every layer may be asked to read mucosa, submucosa, superficial layer, muscular layer, adventitia, serosa will not be there in esophagus. So those kind of questions can come, and so that they'll be able to identify the line and answer accordingly. See, histopathological slide now. They give an endoscopic picture, and after giving an endoscopic picture, and what you see on histopathology is also given. See that what cancer does the condition in the picture predispose to, and what is the characteristic cell seen in this condition, and what is the dye used to stain it. See, complete wholesome. Now pathology for next exam, pathology questions will be like this. There will be an applied pathology. What is a clinical sign based on this? So, they say there's a question, it will appear. So that's the reason we have made like exclusive. Next preparation, these slides are made. Now you can answer this. And by looking into the endoscopic picture, you see it's going to be looking like a malignancy. As it looks like a malignancy, what kind of malignancy are more common in esophagus? Okay. And it looks like a OG junction, correct? Esophagogastric junction. Esophagogastric junction. So lower third of the esophagus. Overall, squamous cell cancer is the most common, but lower third of the esophagus, adenocarcinoma is more common. As adenocarcinoma is more common in the lower third of the esophagus, okay, what kind of cells that are seen and what is the stain that is used? So it's an adenocarcinoma, globular cells, and alkaline blue. Okay. So that's how it is derived. Now a radiological picture like this. Yes. What condition is seen in the above picture? What is the characteristic appearance seen? And what is the name of the surgery used to correct it? Okay. So it's a classical achalasia cardia, Bird's beak appearance, correct? Bird's beak appearance. See that? Typical bird's beak appearance. So what is the answer? Achalasia cardia, Bird's beak appearance, hairless cardiomyotomy. Hairless cardiomyotomy. See this? What is the sign seen? What is the condition? So typically this is like a esophagus, motility disorder of the esophagus. In the motility disorder of the esophagus, yeah, this is typically corkscrew, esophagus, diffuse esophageal spasm. Okay, I'm just showing you the model. Don't worry about the subject. See this question. What defect does the white arrow point to? What is this? White arrow points. So it's a hiatal hernia. Okay. You see the intestinal structure across the diaphragm into the thorax. Hiatal hernia. See this? Identify the non-contact thermal methods of hemostasis used in UG and LG scopy. Non-contact. This is the keyword. Non-contact. So the right answer is APC. Organ plasma coagulator. APC. See, organ plasma coagulation. So identify the American Association of Surgery and Trauma grade splenic injury scale. Splenic trauma. American Association of Splenic Trauma. So what is this kind? They can give you. Laceration has happened. Yes, almost 70% of the spleen is gone and it is grade 4. So what I'm trying to tell you is, so these are the types of questions that are coming in exam and is proposed to come in the upcoming exams. So we need to train the students in all these levels. Yes, please. Can I ask the panelist to ask me if there are any questions? So I have taught you the requirements of the teacher, requirements of the students, and how to make an MCQ, and how to use this MCQ, anti-grade learning, retrograde learning. Yes. And now the floor is open for discussion. Now you can ask me questions and any further input. See, it does not end today. And it's a continuous process that to learn step by step. Yes. So engaging with the student is over a period of time, and the experience will be learned. Not very long, shortly it has to be learned. Now you can ask me questions.
So you were telling us about anterograde and just I'm trying to,
Yeah.
Okay. So you are telling us about anterograde learning and retrograde learning. So when you give admissions to your students, how do you segregate them? Or is there a way is there a pre-admission test or something by which you get?
No. See, that does not work actually. You can't keep any test for training classes. For coaching classes, you can't keep a test. They will run away.
Yeah.
They will not join your course only. They will be scared. So you need to take all the questions. You need to take all the students. That decision of giving anti-grade and retrograde is on the class. Now, I'll tell you, when you play cricket, right? And you decide to make this shot before the ball is thrown on you.
Right.
You decide the shot only based on the bowler, based on the ball and how it spins and how it comes. And the shot is only made that way. The same way, the alteration in the classes and teaching has to be made every 10 minutes, every 15 minutes. You need to keep changing the levels. Only then you can engage the students. So, when you handle a batch, I'll tell you, you can handle two types of students in the same class. Those students who need anti-grade, those students who need retrograde.
Okay.
You can handle in the same class. Good that you asked me this question now. You need not separate the batch and handle. You can handle in the same batch.
Okay.
Very simple. That you post the question first. There will be students known the subject. That fellow will answer. That fellow will immediately answer. Those fellows are only 10% or 15%. Most predominantly, by and large, 85% of students will learn only anti-grade because they don't know the subject. They don't learn well previously. Only those come to you. So they want only anti-grade. But retrograde you have to engage because those fellows will not keep quiet. They will keep on moving the set. Those fellows are always in the first bench. These retrograde fellows will always sit in the first bench. They'll be in first two rows. They'll be in eye-to-eye contact with you. They'll be talking word to word to you. Yes?
Right.
Because they will try to get the control of the lecture. And they will keep answering you. And in fact, they will control the teacher. Yes? And if you don't engage them, yes, they will disturb you. I'm telling you.
Yeah.
If you don't engage them, they will disturb you. So both the groups will be in the same class only. So what you should do is, first you post the question. Immediately the retrograde fellows who know the subject will answer. If he answers correctly, you ask one more question. Why is that an answer? Why you said this is an answer? Then he will say something. He will say something or he will not say something. And most of the retrograde fellows will only answer. They will not know why it is that way. Even if they know, they can't explain it. From there, you start anti-grade.
Right.
Huh?
Yeah. Got it. Yeah.
So both the time, what you have done, you have kept the retrograde fellows also engaged, that they are made to answer. Anti-grade fellow does not know the answer. He has to know the entire subject to answer. Then you finish your theory, then come back to the question again, then complete for both the anti-grade and retrograde.
Yeah. That's the smart thing to do. Yes.
Huh?
That's the smart, correct thing to do. Yes.
So you need to have both simultaneously. And when the question becomes simple, everybody is answering correct, then keep going. Because you should not spend more time there because everybody knows that. Just you need to complete it. And yet another thing I will always use to do in my class, I will buy packets of chocolate. I will buy Kit Kat, 5-star, one basket, Eclairs, and rest of the chocolates in one basket. Difficult question. Other than this, I can ask some random question out of this also without in the presentation. When somebody answers, I'll give a 5-star or Kit Kat for a difficult one. And for a normal question, difficulty level is less, he is answering, then I'll give a chocolate to him. This will keep motivating people. If you don't have a chocolate, you will have 10 rupees notebook, 10 rupees cash, 50 rupees, 100 rupees. This is easy to do. 10 rupees for difficulty level less, difficulty level more, 100 rupees. And 50 rupees question, 50 rupees medium. So you accurate and you invite them to your stage and give that gift to them. And tell them, those all who have got a cash prize from me, they have 100% have achieved. They have 100% achieved results in the entrance exam. This word you should make before you give it. That means for the money that you give, it is not the money that you give. It is the capacity that he has to get this money will have a lot of value. And for all those students I have given money, still they have that money, they have not spending it. That means, and all those people have achieved it. All those people have achieved good in entrance exam. Very simple reason. There are 200 students in that. And the prize money goes only to one student. That means that student is beyond the rest of the students there. That means that student will definitely get the seat. That's a very simple logic.
Right.
And it will come true. And he will go and tell, sir gave thought that day itself that I will get a seat. We are not God actually. We are only trainers. But he will think, oh, that day itself, how sir know, how I will get seat. It's very clear. Everybody does not know, only you know, you will only get a seat. That is the word entrance all about. Correct. So there's a way to motivate.
So how do you create a reward system for online classes?
Online is appreciation. The minute someone is answering correct, nobody answers. Everybody answers A. For one question, you only answer differently. If everybody answers wrong and you answer correctly, if I tell your name, Dr. Kishore, you have done amazingly well. Great. You get an instant recognition when compared to everybody. Na? That itself is a kick and a boost.
Okay.
And what we used to do is, in online also, you can immediately, instantly transfer Amazon vouchers. Now in technology, you can 100 rupees Amazon voucher. See, as I talk to you, I can tell my studio person, you just transfer, you'll have ready-made coupons. He transfers, you will see in the mobile only.
Right. Okay.
Huh? Even more easy. And you can show the phone, sir, Amazon voucher I have gotten, rest of the people can see.
Very good. Yeah, that is very motivating for the students.
You see, I will tell you, there should be no period of silence between you and the student. The success of a class. The success of a class, there should be no period of silence between you and the teacher and between you and the student. The teacher and the student has to be continuously engaged.
Yeah.
And once that engagement happens, yes, finished, chapter closed. All my classes, I mean, it's a boarding time. I mean, I have seen, I don't know what is your experience now. The boarding time and the landing time, the students should not know.
Right.
the journey during when whatever happens in the journey, it is just a feel. And I mean, that's how it is. I keep all my classes that way. So you should also keep that way. The students should not feel, when can I go? You should not keep seeing the watch. You should not keep seeing the mobile. And when this class will get completed, what I will eat next, what I can go, where I can go. So those kind of external factors, you should not be there. You should take them to a different, that's what I was saying. You should take them to a different world. One challenge I had today in this class, I'll tell you what was the challenge. I was presenting a subject to you, which is not related to all of you. That was a challenge today I had. In my class, I'm telling you. What should I have done? I should have taken anatomy for that fact. It would have been common to everybody. But there I could not, but the difficulty, what I would have faced is, I could not have delivered what I was supposed to deliver in a depth in a surgery, because my subject is surgery. So this you should match. There is a way you went, all of you went away. Then I have to take steps to bring you back. I'm telling you, in this lecture itself, what were the difficulties I had and what difficulties you had, that you should be able to predict, and you should adjust in the next class. And next class, if I am making it, you should make a subject universal to everybody.
Right. Yeah.
So you ask more questions, then you get more answers and more clarity on teaching perspective.
Thanks. Yeah, that was very enlightening.
One more important thing that is in teaching, I always used to tell the teachers and faculty, if you say something, you should understand that first. If I'm making something, if I make a statement, first I should understand the statement, what I'm making actually. If I don't understand, if your student cannot understand. See, at times the teachers will say something, even though they don't understand also, for information they say something without them understanding. That is a junk. That is called a junk that you should never say. And some concept you would have understood half-heartedly. That means half-heartedly means only half I know, half I don't know. With something makeup you will do. Some makeups are done to complete the subject. That should also be not done. That means whatever I can understand, only student can understand. I should have a crystal clear clarity on what I am talking and what I am delivering. The same will be transferred to the student. Only that will be effective. So this is very, very important. And you should keep on talking to the student. And you should never allow him. And once you have done, you should ask him to repeat. Once you have done, you ask him to answer. That means you should never allow him to go into his world. He should be only in your world. You should not be in his world. And you should not go into his world. That is also very important. There are very, very influential students. They will carry you to their world. I mean, I have experienced it. And there will be typical hairstyles, there will be typical beard, there will be typical way, and they will keep on making some attention creation, and you will be attracted only towards them, and you will slightly get irritated with the behavior, and you will start shouting at them. You will not look at that side, and then it will disturb. That this is a physical class, not an online class. Online class you can mute the video, but in physical class I'm telling about. So in those situations, it is better to have them in the front row. If any student is making any disturbance to you in the class, to the other students, is the best way to have the student, is the best punishment you can give them is to ask them to sit in front of you in the front row. That means you will not see him after that. Because you will never focus. And because I used to stand and take class, I don't be in the stage. I used to stand. He will be, not be seen at all. I'll be seeing beyond that. So I'll have the troublemakers in the front row. Ask them specifically. And after that, they can't make any trouble because they are put out of their clown and they will not be the other friends. They will be separate. So there are a lot of on-site teaching techniques, teaching techniques that are plenty. And you should relate your subject to the reality. If something is happening at that particular point of time. You would have seen in Hindu or I think specifically in Hindu or Times of India, this Amul alone will create a cartoon according to the happening on daily basis. Have you seen it?
Yeah.
The Amul advertisements you see, if there is a cricket and they will put a picture of a cricket. If something is happening, accordingly they'll keep changing. Similarly, your subject should also have a time reality. You should have your subject with related to the time reality. So today there is a conference to Aravind. I said there's a conference in Pedicon in 19th to 23rd. So you should create a reality. So that's the time reality you need to create in your subject, when you talk. And whenever something is happening, you should first, not a good thing has happened, then first to give a concern and address to that, and then start the class. So when you be in a reality, and also you should know the birth dates and important dates to wish your students. Birthdays, you should send a message to them. That means you get connected to them. Then when you talk in a subject, they listen to you. And when you should not do mechanically, you should do truly. That should be your habit actually. And greeting a student, say good morning. And all this all makes a lot of difference, a lot of
Definitely. Yes.
And even if you don't provide your food for in your institute, after the lunch break, when you start the class, you should ask them, have you all had your lunch? Have you all finished? Only they are going to have and they're going to eat and come. For them, if you eat, it is like you giving the lunch to them.
Right.
Yes. Today,
Yeah.
I didn't give tea to you, but I asked you, please have a tea. It is like I'm giving you tea in your place. So I have not given you any assertive, but I gave a break that I have given a concern that you're attending a long class. You need to have a break. Whether you had a break, tea or not, that is different. But you need to have the concern for that.
Yeah. Right.
So, those many parameters are there, and those many parameters could be added and incultivated as you could attend lectures like this from many faculties of experience for years, and they can give you and deliver the fine techniques that could matter.
Yeah. Thanks. That's all so experiential and it's on the go. These are things that you gain through experience. So,
Yes. That the seasoning. And one thing we should never be is to get angry. That's very important. That is very. I mean, angry towards a student only has to be there only for their concern, not about faculty's concern.
Yeah.
That is very, very important. And it should always be a smiling face. Whenever you take a lecture, you should always a smiling face. And no matter what is happening outside the world in your family or outside, let's keep it aside. And when you come to the class, you should be 100% into that. 100% you should give. Immaterial is 100% has to be here. See, you totally agree with me. I am 100% with you today.
Absolutely.
Correct? So
Absolutely.
that I should not say, that the student should say. Sarah has given me 100% time and brain to me. So that is very important. Because
Right.
giving 50%, 25%, 30%, student can understand that. They will identify it. And they will understand they are not very keen. Because when you had a difficulty, at times teacher, what they will do is they'll skip to the next presentation. See, when you had the first 5 questions, when I was discussing with the theory from the Bailey, when you have difficulty, my lecture is getting a dent there. So what should I have done is I should have gone to the next image-based presentation, but I didn't do that. So what I did, I went front and back and front and forth. I came back and came back. See, because that strain that you need to do, because that lecture you started, whether by knowing or unknowingly you started it, but you need to do a justice for it when you come out of it. So that is very, very important. You should not cut corners. That's very important.
Yeah.
And you should struggle. Even you struggle, students will know it's either struggling. But he has an intention to teach me. That's you should convey them to them.
Yeah.
So this parameters are very, very
Important. Yeah.
justice. Justice to the students very important, and it will speak on the results. And I have seen.
Yeah.
I've seen traveling along with the student. And one thing important more is the teachers will read less than the students. It will not work for the students. Teachers should learn. If faculty reads 100%, student can read only 50%. It's not student read 100%, faculty reads 20%. Faculty here is not examiner. That you should understand here. The faculties are not examiners. Faculty will get a feeling like an examiner. That's wrong feeling. Only examiners are examiner. Examiner can ask question without knowing the answer. Understand this. Examiner can ask any question. They did not know the answer. They did not give an answer to the student also. They can just ask the answer. When they say right or not, they will decide. But here, the teacher should behave like a student. That means he is like going for an exam. That's the feeling that teacher should have. That means he is appearing for the exam. So on behalf of the teacher, rest of the students are appearing. So that's the feeling they should have. It should be like a student, not like a teacher. So these parameters has to be adopted for a competitive entrance examination teaching. That's very, very important. And you should be a thorough knowledge of last 5 years what is asked in entrance exam. Whatever the entrance exam you're going to teach. For that entrance exam, what questions they have asked for last 5 years. See, this was last year general surgery questions which were asked. So this kind of questions that you should discuss with the students, and you should make sure that you are able to solve the previous year paper. And only if a teacher has a capacity to solve the previous paper, you'll be able to teach for the next paper. So that impression that should be created for the students. Okay, so this was some of the questions which are asked in surgery and for the previous years. Just I want to just tell you. So from this only you'll be able to derive which area is important, which area is not important when you teach. So you'll be able to tell students last year, 2022, this question was asked from this area when you teach. And 2021, 2020, like that you should mention. And for that you should have known what really, because students also have read the old paper. And when you say something, they should be able to relate to it. That's very important. And what I will suggest you is, you get my personal number 98400 44686, and what you do is you make one presentation like this, what I have done from your subject only, from the preferred topic from your subject. Yes. And next Sunday, I will ask Mr. Mohan, the coordinators, managers, whom you booked this course through, and you kindly present 10 minutes enough, 10 minutes of 5 questions of your presentation, antegrade, retrograde, whatever the way that you wanted to do. You present to me. I will give you the feedback where all alteration has to be done, how all to be done. And with that, you can make one more final presentation on the subsequent Sunday. I will listen to you, and I'll give you a perfect template and a feedback. And with that, you can start your teaching style and teaching experience. And you want an opportunity in Speed also, you are most welcome to do so. And we will give you a structured program when you come for that. There is no cost there. You will be earning actually when you give a structured program in Speed, and we will give you a financial plan for you to earn what all you do, how much you will earn. Like that, we will give you a structured program. You can go through that also. Or else you want to teach somewhere else. You teach in your college, teach avenues in some coaching center. You want to get a job opportunity. This can all definitely help you out. Okay. So this is my idea is to do this. Why I'm going to do this regularly, monthly once I want to do this. And whoever is interested in teaching, I want to inculcate all this, whatever I have learned over years to them, so that that could give some inputs to them to teach the students, and student can be benefited by it large wherever they teach. That is my idea. Okay. So, was this class, I want to take a feedback from you. This is the first class I'm doing in training. So far, I used to do internally in a different way, but in the open forum, this is the first class I'm tried as training. You tell me your feedback. Was this class helpful for you, helpful for your time and the money that you have spent? Kishore sir, what is your take on it? Because already you are a seasoned teacher. Was this today's session was useful for you?
No, it was brilliant and really very enlightening, beyond my imagination. Frankly, I was not expecting it to be the way it turned out to be. And I wanted to actually speak about this for a couple of minutes, but I was also thinking that I am the only person who is talking a lot compared to the others. So I didn't think I was bothering you too much. I was asking some...
you can ask a number of questions. That's the reason why.
Yeah. So, but to summarize what I discovered today was that you are genuinely an expert teacher. You are very fluent with your language. You have excellent command over English. You have a very commanding personality, a persona which suits a teacher. The moment somebody looks at you, you radiate that effect of a teacher, which is very important. Your body language, your everything, your confidence level, everything is very, very positive. You have a very positive demeanor, and you motivate a lot. And the biggest quality that a teacher needs to have, which you are loaded with, is the passion. It just oozes out like a healthy granulation tissue. It oozes out. I'm not a surgeon, but I think that's a good way to describe you.
Yeah.
And as you say, you're always smiling, which gives a very positive energy to the students. And you also have a very structured approach to what you tell, which makes a very big difference. And there were some very good takeaways today, like we should always be energetic. We should never be negative. You should never get angry with students. These are all very practical tips. And when I teach students for USMLE, it's always a problem. I mean, which I did pose to you, like for example, anterograde versus retrograde. Those are concepts which always bug me, because there is always that mix of students. There are students who are at different levels of preparation. That is point number one. So you need to create a tailor-made kind of situation for, which is very difficult to do. It's also important for us to understand that every student has a different learning curve. Sometimes some students get it in the first go. Sometimes you have to ask for repetition. So understanding the psychology of the student and creating something which is tailor-made is a dynamic process, as you just demonstrated so well, because you knew that you are not talking to a bunch of surgeons. We are all different. There is a physician, there is a pediatrician, there is a pathologist. So physician, yeah.
Physician
so,
also.
Yeah, physician, pediatrician, pathologist.
Yes.
And you are a surgeon. So I very much appreciated how you dynamically changed your teaching process on the go. I mean, on the ground, running. So these are very, very impressive teaching techniques. And this is absolutely, you're a teacher beyond compare, is what I can say from this very brief encounter. So thanks a lot, is all I can say. And I'm not saying anything, yeah, this is all completely dil se, so it's straight from the heart, and it's not meant to praise you or flatter you.
Yeah.
So it's all genuine according to me.
Thank you.
Thanks a lot.
Thank you very much. Thank you very much for a wonderful feedback. Before we finish, I want to tell you one thing. One simple story I want to tell you. See, when Speed started in the year 2002, there was only one center in Chennai. Then I expanded, next center I expanded was to Bangalore, to Coimbatore, and down south from Hyderabad, Bangalore. In all those areas we channelized. And we went for a meeting into Delhi, New Delhi. And I went to New Delhi and I had a morning breakfast at the Connaught Place. In Connaught Place, I had it in Saravana Bhavan. And there is a Saravana Bhavan branch in Connaught Place.
Yeah.
And I had a dosa and vada there. And having it, and I thought, oh, this fellow from Madras, he has opened a branch in Delhi. And that motivated me a lot. See, the motivating factor could be anything. And that motivated me. Why I can't teach students in Delhi? See, why I should not? I mean, what is a barrier for me to teach? Then I, you will not believe, next week I opened a center in Delhi.
Wow.
When I opened a center in Delhi, you see the challenge. The advertisement was given to students of AIMS, Safdarjung, Lady Hardinge, all those medical colleges, and we have given. And I said, you come for one class and you see how it is. And then if you like it, we'll take it beyond that. When I invited them, they all came with a lot of reluctance. And I had students from AIMS, and especially who are typically in attitude, what this fellow can tell me, which I don't know. Very, very typical. Yeah. And when I was taking, they'll be chatting. And they will be chatting internally. And there was a question which was posted to me. And to know, I know that he knows an answer, but he just want to test me whether I know it or not. I mean, it is to judge the teacher who has a capacity to teach or not.
Right.
Now, for that one question, what I did, I'll tell you. Because now I am in a position, I cannot be angry with the student, number one. Number two, they are doing it purposefully to me. Still, I cannot show it outside also. And if I succumb to it, I'll be a failure of that place. So there are three challenges which I am in the single place that I need to counter this. Now, how do I counter this? I took that as an opportunity. That one question that was posted to me, other than the subject, they're doing everything. And the entire batch is selected not to answer because when it was called, they have come, and we have organized one free lunch also for them. Only for that, they have come around 11:30. Then my slot is only for 1 hour from 11:30 to 12:30 to impress them. Now you understand. Now there is one question that was posted to me at almost close to around 11:15. And that I took as an opportunity. You tell me, for that one question, I answered non-stop. I answered that non-stop for 45 minutes. 45 minutes, I didn't do anything other than answering for that one particular question.
Right.
Yes. And that question that was asked to me on about a most common cause of acute pancreatitis, was it caused by a gallstone or by alcoholism? Then I said it is by gallstone, and I started on a gallstone, and I finished to the end of the complication of on a gallstone, and that took me nearly 45 minutes to challenge him. And once I finished the question and I finished the answer, the entire batch was an absolute silence and a round of applause and a standing ovation for that. Then they understood we have never listened to a lecture like this in any of our colleges. It's an amazing and teaching beyond. You'll not believe. I had almost 45 students in that class. Yes. And all the 45 students, for that one question which I answered, I was able to convince them. My next batch, I had around 250 students. Next week, subsequent week.
Wow. You have that power, I can see that.
So 250 students they brought in, and from there it started. Then I was very happy that in a capital city, I mean, you can have center anywhere in India. There is also some value, but having in the capital city and teaching people in the capital city has a totally a different thrill and a different ideology and a different kick. And that I mean, 100% hardcore, I enjoyed it. And I felt I was able to convince. I mean, I told them, see, you need to accept knowledge anywhere. It does not go in borders. Anywhere in the world. It's not only in country. It's not only within the scope of this country. Anywhere in the globe, whoever has the knowledge, you need to accept it and you need to appreciate it and you need to learn it. So that's how I told them. And even today, I mean, great friendship. And I'll tell you one more important thing. One more important story before I call it a day, before I call it and close it. Teacher never should think as a student, as a, like a customer who's coming to buy a vegetable or buying something as a product and a customer relation. It should not be that way. For all the student, I maintain my relationship even today. They would have finished long back. I'll tell you, my first student name is Nagasai. My first student name is Nagasai.
Okay.
He's the first registered student in my course. That was 6,850 was my course fees. This was in the year 2002. And this student decided to join our course because the speed is SAI Supreme Postgraduate Entrance Exam Training Center for Doctors. So there was a SAI, there's a connecting factor. See the factor, connecting factor, see there. They thought, I am a SAI devotee, the name of the company is also SAI, they would do something with SAI, then she joined. No one joined. She is the first person to join. And I told her, see, you are the first person to join the institute, 100% you will get a seat. Heartfully I said. And she also got 350 rank OG, she got, and she got a seat also. The very first registered student. And from that day, he keeps saying, any student who registers first in our course will always get a seat of their choice. And it's still date is happening because it's a keen interest that it has. So that we need to add those good values, not sentimental values, there are good values that to add. So, and what I was telling was, so the students should be remembered that they have not come here, they got the seat, they have completed and gone. No, it is not that way. I mean, you should establish a channel. After that, they will have a lot of help and support system they might require. So today we have done a course. We can't say, okay, Arvind, Kishore, Shilpa, everything is over, chapter closed, bye-bye, thank you. So it doesn't work that way actually. For a teacher, it doesn't work that way. It is not a movie. It is not a one-time that movie that you watch and you give a revenue or a rating and then you go. No, it doesn't work that way. It works that way. You need to mentor them for over a period of time. If they are interested, then you need to catch hold of them and they need to mentor them over a period of time so that until they reach, they want to achieve. Until then, you need to give some support to them. So that's very important that I follow it. So, I mean, all my students, I still follow it. And whenever they ask us about, they might have studied 10 years back, he may message me, sir, what should I do, sir? I have this difficulty. In surgery, I have this difficulty. You tell me, what is your opinion? I cannot say your services are over in 2010 and after that I don't have any services for you. I mean, if you want to do something, you pay me something like that, then that is a business. And that is not a mentorship. Yes. So the faculty has to turn like a mentor and to be a turn as a role model. So when you have to do that level, you will have to continue. So you should understand he is liking you and remembering you and calling you after 10 years because you have made an impact in his life. He didn't call you anybody else. He has called you. That's a privilege actually. So you should not think him as a disturbance. So that I strongly follow. I mean, everything there is no return actually. For everything there is no return on investment. Yes. I mean, every time there cannot be return of investment on materials. There will be return on investment on goodwill also. Good return on investment on good gestures also. So that is going to take a long way under statesmanship. So you need to be looked at, though any business venture or teaching there is a money involved or cash involved, but you should go beyond that. And one thing I always tell upon, if I am worth of getting 10,000 rupees from a person, I should get only 5,000 rupees from him. And you should not encash the full skills that you have learned. That's very, very important lesson I have learned in my life. If I can get for my services of 1 lakh, suppose, but I boiled down to get only 25,000, 75,000 I don't charge. For whatever the reasons, I don't want to charge, but still I gave what I intended to give for 1 lakh rupees worth. Yes, you will be remembered for that.
Yeah.
It is not that this fellow is a fool, he didn't encash at that point of time. It is not that way. So there are 2 coaching centers which could be there. One will charge them 1 lakh, 75 to 1 lakh. There will be a center where you charge only 25, 30,000. And it does not mean that that fellow is doing something great, this fellow is not doing something great. It's nothing that way. It's a perspective. That means he is charging for something which is on materialistic value, and for what the value of knowledge cannot be charged. That should be the idea. The knowledge cannot be charged. The knowledge, what is acquired, the knowledge transfer, there should be the cost or the value of it should not be determined. What I'm trying to tell you is the knowledge does not have a value. In a course, when you do a course, you print a book that has a value. When the working hours, the studio time, the hours, those has a value. Zoom has a value. Only those values has to be addressed. The knowledge, the real, that should not have a value at all. And you should not determine this value of the knowledge is this much. So that has to be given free.
Yeah.
With a little of margin to maintain your system going. That's how it is. So when it comes to finance, so you should always put it like as a statesperson, as a resourceful person. That's what this. The problem is not able to end. This will be a problem when you become faculty. You can't end the show. Then you will keep on going around with that because you will not be working in a conscious memory. Now I'm not in a conscious memory. I'm in a subconscious memory. You put on to that level, then I'm not able to come out. It's very difficult to come out. So when you see someone doing it, and that's the person from where you need to learn. That you can't leave a lecture disconnect. When you have to disconnect, you will try to keep extending to it. What's the time now? Now, you should not have a watch as a teacher. It's very, very important. Students can have a watch. You should not have a watch or any watch around you or a phone that to tell you that you are in this point of time. It's very, very important teaching aspect that you need to learn. That means you need to teach as long as you are convinced that you have delivered it. What you intend to deliver, you need to deliver irrespective of time. I think I will keep going like this on and on. There will not be an end to it.
The others have questions as well.
Yeah. I mean, madam has asked me a class. This is the live class. You are talking about the offline class, is it?
Sir, good afternoon, sir. First of all, I'll introduce myself. Sorry for coming late on the video. Sir, I'm your student. I could see the same enthusiasm. I was in Speed Bangalore, Good Shepherd. I have also received chocolates. It's the same enthusiasm and ideas that I have been hearing today also. Congratulations, sir. Speed has gone beyond way. When we joined, it was pretty new. So my question is, for online classes, nowadays there being more of a demand, but I always feel physical classes are very much effective, as I have also taken physical class. So what is your experience, sir? I think online is getting more of an importance now. Most of them are going for online.
I'll tell you. I will answer this question. You're talking about an offline and an online. See, my career for 18 years is offline. All of you know that. And I mean offline is there. Now I am sitting. My expressions are limited to my face. My expressions are limited. My body language is limited only to my facial expressions. But in an offline class, I mean in Bangalore in Good Shepherd Auditorium, I have never sat in the stage. I was been going around each and every student individually. Understand that? I'm going each and every student individually, and to move around, to walk around, to run, and to put the wireless mic and to keep interacting with the student. And that is totally a different and an amazing experience for a student and a teacher. That's a great experience. And you feel the vibes of the teacher on you. That's how it is. Whenever I take the class, now I'm not able to transfer my energy to you. I'm just making it through my expressions and my articulation. But in a physical class, I will literally disseminate my energy levels and enthusiasm to the person who's sitting before me and sitting all around. I'll make sure he is energized and he has physically is getting that kind of an energy. And when he goes out of the class, 8 o'clock they come into my class, and night 8 o'clock when they go out of my class, any student will get tired actually. I'll feel, okay, headache is there. I'm feeling very tired. Whole day has made me to sit. But when they go out, they go with full happiness and they feel, okay, they have achieved something today. They have learned something today. So that kind of a feel where a physical class can give, because the entire body language and the way it is taken around, the way they're talking and the way it's going around is totally a different feel at all. I mean, now for that to do, students are not there. What I'm telling you, because students are not in that mentality. What you are in a generation, what today's in generation is different. I mean, here the student, what they are up to is, tell me exactly only basal cell carcinoma, most common skin cancer, only that they want. They don't want anything else. They don't want to know what is skin. They don't want to know what are the layers of the skin. They don't want to know anything about it. They are very, 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 very particular, and they are very time bound actually. And they are very time bound, and their upbringing itself is totally different. Their upbringing, there is the kind of emotional connect is very less. The kind of connect which I am talking about a student, I could get connected to you until today. I could get connected to you as well in the same way I've been connected to you 10-15 years back. That will take hardly 10-15 minutes. Even if I struggle, I cannot do with a student today very difficulty, because I'll tell you, they are living in a different time zone, and they don't want to have a long didactic lectures. They don't want any kind of emotional value to be incorporated in them. They wanted to what they want to have only, they're allowing to do. You can't give something extra. I mean, that you wanted to do, that they are not willing to adopt it. Those number of students have grown by and large huge. It's not because of anything else. It's because of the entire community is that way. I mean, they are upbringing in that kind of a community. So there is a total disconnect from the receiver perspective, not on the teacher's perspective. Even today, you allow me, I will love to take for 1,500 class in a physical class. But the students are not in the same mindset to take it. Because what will happen is, today, the students will come for the 8 o'clock, but around 12 o'clock, 1,000 people will go. But that time, you will be demoralized. I'll tell you, one student goes out of the class. For me, if I say you take me, if one student in a Good Shepherd Auditorium goes out of my class, I'll be disturbed. That means I feel, okay, I have done something which I'm not able to satisfy. They are going out. I will be totally disturbed out of it. So that's the reason why whenever a student goes out of the class, they used to come and tell me in the breaks, so this time I'm going, I have an emergency, I have to take care of it. They'll come and they also know, student also know. Sir will get disturbed, they will get disappointed even for one student. So attendance is very important for a teacher. See, whenever an institute engages a teacher, irrespective of number of students, they get the money. But the success of a class is about the attendance of the student. That means morning 500 came, 800,000, it ends in full numbers. That's very important. So that will be very difficult to maintain in a physical class today. Very, very difficult today. The students are come and go. That way is there. But the online class has taken over. And online class has taken a huge shift, and the learning techniques also have come into a huge shift. And in future ongoing, it will be online class will predominate. Because one advantage in online is there. Now, when I switch on all the videos here, yes, all the videos are switched off, but muted. And it is in online class only you and me, right? I'm too many, but to you, I'm only one. You understand that scenario. But in a physical class, it is not there. Many is many. See, when you go in a webinar, it is one-to-one only. Na? You can ask any questions. You can type any questions. And it is only you and Dr. Vinayak. Whatever you want to discuss. That means you get an attention there. If the teacher is providing the, allowed to chat and allowed to talk with the student. So there is an advantage here as well, and time convenience. Now today, if I had a physical,
I think that is the major thing.
If Dr. Shilpa is asked to come to Chennai, you will not come only. You will not take this class only.
Yeah, that is there.
And we do not engage today. We do not engage in this lecture today. So that is the most important. Na? So your time, not my time, your time. So today it is all about the students. Students' time, students' place. So I am coming into your place and I'm able to deliver what you wanted, not what I wanted. So they are changing actually. When in a Good Shepherd auditorium, I did what I wanted, what I want to teach, what I want to deliver, that you took. Today, it is at your time, at your place, what you wanted, I have to deliver. It's the era of Swiggy and Zomato and Zepto. Huh?
Yes, sir.
So I think there's a time zone, time change, time loop. We need to adopt it.
Okay.
Have I answered your question completely?
Yes, sir. Yes.
That is also important. You mean if a question is asked, you give an answer without satisfying the student. And when you ask the student after answering, you will always say yes only. But you should know whether they are internally satisfied. That is also very important for a question. Only then the doubt clarification will be completed. These are all very important points. One question asked, that answer you will make, they will not be convincing them. Still the student, okay, leave it, fine. I wanted something, but he's saying something. That will happen in a class. I wanted an answer for something and he is answering something else. So there should be a connect there also. In case you know that you have not given some relevant answers to them, you tell them always, I will refer and come back to you. I am not able to give at this point of time. I'll refer and come back to you. Is the best ever answer and an authentic answer. Seasoned teacher can give.
Thank you, sir.
Okay. Anything else? Dharnidharan and Aravind. Yeah. Is Dharni here or left?
Sir, I'm here, sir.
Thank you. I was just for a minute. Sir. I had a palpitation. You left. Yeah. Tell me.
I'm there all the time, sir. Huh? I cannot miss the opportunity to listen to your legend like you.
Thank you. Tell me, you have any questions now?
Sir, one thing I have is that, sir, among all the 19 subjects that we have for the PG entrance exam, medicine is a larger subject, sir.
Correct.
At least biggest among the three.
Correct.
And it will take a lot of time. And moreover, I have seen a lot of students because I'm teaching the undergraduates now. Okay. It's been a year.
Okay.
So when they are preparing for postgraduate entrance, they feel that it is okay to leave medicine because it is a huge chunk of it will take a lot of time. Okay. And it won't return as much when compared to the other subjects which will have also a similar amount of yield in the exam.
Okay.
So most of them are leaving. I've been preparing in a format in such a way that I have to take less time to convey a lot of topic to the students. Sir, should we do all the time the pen and paper kind of presentation or PowerPoint kind of presentation? That is the actual question.
Okay. See, I'll tell you, teaching medicine to your students should be weekly 5 days. Because medicine is a huge subject. First question I'll answer. If somebody is not studying medicine, they want to go for the exam, 100% they'll not clear. Point number one. I'm repeating again. Somebody wants to omit medicine and want to go for an entrance exam, they'll not get the seat. Number one.
Of course, sir. I did the same mistake when I was preparing for the first teach.
I'll tell you. Number two. Correct. Number two. If you want to teach medicine, it is not on one stretch. You can't do it because Harrison is the standard book for preparation. So for that, Harrison cannot be learned in a crash course. Harrison cannot be learned in a few days. It has to be learned over one full year in small presentations, 1 hour presentation every day. So you make small presentations every day. That means morning hours or evening hours, according to your students' convenience, make 45 minutes to 1 hour presentation of one topic every day. Try to cover the entire Harrison for the requirement of the entrance. You can't cover the entire Harrison. So for the undergraduate entrance examination, that means a PG, UG students going for PG, whatever the requirement you know, and you are that important topic, In hematology means multiple myeloma, hemochromatosis, Wilson's disease, and microcytic iron deficiency anemia. These 4 topics are very important. You need to cover, not the entire hematology. And hemato-oncology is also important. AML, CML, and CLL, and those areas which are prone important areas which are you need to cover. So like that, you need to split the entire book and into various topics and learn small topics and incorporate that into your teaching session. So you cannot omit medicine and do anything, but you need to do it. What is the last part of your question?
So should we do a pen and paper kind of presentation? Or
pen
a
and
point
paper is
by
very
PowerPoint
important. Correct.
presentation?
Pen and paper is very important. Now, I mostly use teaching and also images. So both has to be there simultaneously, because images you can't draw that way. So real images and real demonstrations and tables has to be there from standard textbooks, and simultaneously you need to write also. Only then the student, you will be able to attend and you will be able to hold for a long time. Both you should use.
Okay, sir.
And OPGAI or Nelson you should do. OPGAI, the UG students will learn, and you should sandwich between OPGAI and Nelson. Nelson should be your standard reference, and OPGAI is for the creating the relevance. Because OPGAI is what, as you said, UG students will read. Suddenly you take it from Nelson, there will be Greek and Latin to them. So for you internally, Nelson, and output in relation in the reference to the OPGAI with the student's language, you should do. So there's the art that you need to learn. Because questions will be from Nelson. The students should have read OPGAI. You can't expect Nelson to be incorporated into them. So whatever the topics in OPGAI covered in respect to the Nelson, that has to be bridged. Internally in your mind, Nelson has to run. And when you deliver, you need to talk the language of OPGAI you need to take. You understand what I say? See, the standard book, textbook of surgery is Schwartz, Sabiston, and Bailey. The fellow would have read Manipal and some Das, and he will not come to the standard textbook at all. For that reason, if I say I'm going to take classes through this, he will run away from my class. So I need to engage him in his book, and I need to deliver the content from what is actually required for the entrance. So it's a double process that you need to learn over a period of time. So okay then, and you have my number, you get in touch with me. And what you do is, in case you are interested to present to me, and 2 subsequent Sundays I have allocated for this, for you. And you can make a presentation and you can do it to me if you're interested. It's not compulsory, it's an option I'm giving you. And I can sit for your lecture as a student and can tell my feedback. And one feedback I'll give you, you take another 1 week or 15 days and you fine tune and give a final feedback. With that, the same template, you start developing your own content, you start teaching. Okay. Okay then, thank you very much for joining, and good luck to all of you. Best wishes to all of you. Thank you very much. Bye-bye.
Thank you, sir. Thank you very much.
God bless all of you.